Bismillah ar-Rahman ar-Rahim. Lalwanzawakanik, Alawandawit, Alawalisit, Alawikaktamakalawi. Today is the 22nd of Ramadan, 1447, and it's also March 11, 2026. I believe it's still March 11. I believe so. If not, the time will get corrected. Anyway, I came home because I was at the dentist. I was out of my area and I had to do my taxes. I did that. Then I had to, just do stuff that, try and take care of some business with what I have. But this video is about, womanhood, and maybe it will help someone else out there. PCOS ladies who have different diagnoses, because PCOS could be from different things. Like I was talking about earlier, I was looking into my adrenal glands, and there's women out there who have different types of PCOS issues. It could be, from them having insulin resistance, so, and all that other type of stuff, diabetes. I don't have that. Okay, so that's what's leading me to my adrenal glands. So with that, I have this. I just took this again today. I purchased this like last year. I haven't been taking it a lot because I've been using some other medicines, but I won't show. But this is my Inositol. What is this? Intimate Rose, Mayo, and Dicero. Inositol with ashwagandha and vitamin D. And this is supposed to support women's health and reproductive health. Basically, I purchased this because I was trying to get my menstrual periods regulated. And so I purchased this because there was reviews on Amazon stating that the ladies who took this was able to regulate their menstrual periods. And it's good for women with PCOS. So that's why I have it. Now, I'm not gonna say it doesn't work. I'm gonna say I don't take it a lot, obviously, because I still have I'll say one third left of the bottle. And then I have my multivitamin for her, women's multivitamins. I just purchased this today after the dentist appointment at Ridner's. So my hijab keeps slipping. But yeah, that's supposed to support my overall health as well. I have seen some improvement with my facial hair growth. Before it was it would grow quickly and would grow every day, and it was rough to touch and everything. But now my face is a lot softer. When I shave, if I shave in the morning, then I wouldn't have any of the shadow issues. Like right now, I didn't shave yet, but I could feel the difference. Like my hair is a lot softer, so when I do shave, I have a smooth face, and that's what I struggled with in the past. So I think that me getting my menstrual periods back and getting them regulated, making sure that I have them frequently, because I'm supposed to have them every month, that's what's been helping me to slow this growth and trying to heal these adrenal gland issues, because that's where the hormones are produced. And then I have this the Yarrow. This was gifted to me to help me. It says it's for fevers, common cold, amenorrhea, however you pronounce that, passive bleeding from bulgy mucosa, and some other stuff. And then, pain with bleeding and some other stuff. So it's supposed to help with the menstrual cramping and all that. And then I was also gifted this. Now I haven't been able to finish this because of Ramadan. I've been fasting, and so I haven't really been eating or drinking a lot like that at home. I've been eating a lot more out on my work site. But yeah, this is the motherwort that I was given. Also to help with my menstrual periods and to help calm me and everything. And then I also, when I have the time, drink green tea. So this also helps, especially when I don't put sugar or anything else in it. I just drink it like hot, and put it in the water. And it's flavorful on its own, so I'm okay to not have any sugar in there. But yes, I've seen big improvements in my facial hair growth. It has not been as rapid. My face is very soft, and that's what I want. That's my goal. To get the hair to stop growing completely, of course, I have to heal the root, the core issue. So, like I said, I'm going for those adrenal glands, making sure that I learn how to manage stress, especially extreme stressful situations. I learned how to manage and not go into the fight, or, freeze mode and all that stuff. Because that does a lot of damage as well. And, it's just not a pretty thing for a lady to have dark facial hair. We have peach fuzz, some of us ladies have peach fuzz, but to have like dark hair that's visible and have light skin. I had light skin all my life. So to have those things visible, it does have an effect on your self-esteem, but I worked on that. I'm one of those people who had to work on my character and personality. That's why my character and personality is way above the average, because that's what I had to work on. Maybe some other people find me pretty or something like that. Okay. But I'm just telling the truth. I had to work on my personality and my character. That's what you do if if you have self-esteem issues. That's the first thing you work on, your personality and your character. And then once you heal from those self-esteem issues, which really is just marketing, because a lot of the marketing for women is like, they know we have hair. That's why if you go to Walmart or any other store and you walk into those stores, you will see the market or target us women for hair removal, for our mustaches, our chin. So they know we have hair on our faces, right? But to actually see a woman like me or any other woman with the facial hair, then it's like stigmatized. But if you go to a store, you would literally see that they have bleaching products to bleach the hair on your face if you don't want to just take it off, waxing. They have all types of stuff, especially for your legs, for your whole body, hair removal. So it's no surprise that if I'm mentioning that I have body hair, especially troublesome body hair that's growing on my face, yeah, it's a normal thing. If it's not that, there's the other issue of, dealing with ignorance and people trying to emasculate you for something that you can't control. Like, you think I just wake up and like, God, give me hair on my face? No. It's there, and then I have to learn how to manage it, how to deal with it. And, just not get with people who are ignorant as well. That's another thing. Avoid men who do not know women, who do not understand women's bodies. And, who just overall are not educating themselves about what can happen to women if they are having any hormonal imbalances or anything like that. And especially if men, I'll just say, like, you don't want to get with a man who don't know that women also have testosterone. We just don't have it at the levels that men do. Okay? Because when you mention that word, they just automatically think, oh, men have testosterone. That's true. But women have it too. It's just not at the levels that men have it. Okay? So, I mean, this is just biology and medical records. You could just see, But I digress. So, like I said, just stay away from those type of people who are just ignorant. And then I did recently have a menstrual period, especially during Ramadan in the middle. I talked about that before. So, I keep my products in a little baggie just in case it rains. So I have the size 4 leak protection for menstrual periods, and then I bought period panties. I just been trying everything because the period products that are out now are very expensive right now. Like, you know, taxing us on what we can't control once again. But that's why I purchased period panties. So it's like, I'm going to try that out. So technically, the period panties are supposed to be like one pair of panties is equal to 3 tampons. So if you can just imagine, like, how long you can wear 3 tampons, before you have to, like, take off the panties and put on new ones. So if I'm not doing that, then I will wear the pads, or, I haven't been using tampons a lot because I had surgery and I wasn't allowed to insert anything inside because my cervix needed to heal. And that's when I had that cervical cancer diagnosis, and they was just trying to make sure that my cervix healed. So they didn't want me to put anything inside. So make sure my cervix healed. And then once my cervix healed, then they told me that I could use tampons again when I have my menstrual periods. So I have used it, but just not as often as I used the period panties and the pads. Then there's these babies. This, which is the panty liners, which helps. Because what I was talking about before, how with Ramadan and the sweating and, how your body just naturally excretes moisture, and how you can't eat or drink or make any sin or anything like that. So I was like, I was having a little issue. This is prior to my menstrual period, by the way. Because I started March 4th, and now I'm no longer on it. I was on it for 5 days. So from March 4th, if you can just imagine, prior to that, I was having some issues, and I was like, I need something. So I was going Google trying to figure out what was happening and why it was happening, and then there was a suggestion, like, buy period panties. So, like, okay. So for those who don't know, if you leave yourself in a wet environment, it's kind of like babies with diapers. I never got pregnant yet, but I have nieces and nephews who I used to change. Like, if you leave them in wet diapers, they can get diaper rashes and all that stuff. So it's the same concept with us ladies. Like, if we're constantly wearing underwear that's getting soaked because we're sweating down there, or, there's just extra juices that's coming from us down there, and we can't control that because that's what happens. We have that discharge. It's good to wear these because it's going to absorb all that moisture, and your skin is not going to be just sitting in that wet atmosphere. Now, what happens if you sit in that wet atmosphere? You can get yeast infections and all types of infections, and vaginal, what is it called, BV, bacterial vaginosis and all that. And you don't want that. You do not want that. That's where you start smelling down there. like really bad, like fishy. You don't want that. So you have to make sure that you stay dry down there, and panty liners. So that's what I was like. I did not want no BV. So other than that, I also purchased this because like that's gonna help the panty liners to absorb any moisture, and these good wipes. So it's flushable, but I like these because I feel more fresh. So I feel like a big baby because I constantly have to go to the bathroom and wipe, like cleanse myself. And also in Islam, like we're supposed to like always clean ourselves after we use the bathroom. We can't have any fecal matter or any urine on our bodies at all. We have to take all of that off after every single bathroom use. And I was just like, when I use the water, like the water bottles, because we don't have bidets. So when I use the water bottle, like it leaves me in a wet atmosphere, and that's what I'm trying to avoid because I don't want BV or any other infections. So I was like, okay, I'll get the wipes. I can still use the water bottles to cleanse, and I'll do a double cleansing with the wipes if I don't have the water. Do this because I need to like stay clean and dry. I want to be clean and dry. I don't want to have any of those wet atmospheric things going on down there. That's something I don't want. So that's what I've been doing. And then for my oral health, I did myself the greatest favor. I purchased this, and so far I brushed my teeth. I didn't shave my face because I'm not kissing anybody. I'm not doing anything like that. So I'm okay to have like a little show. But yeah, I was brushing my teeth, and then I used that to like gargle, and then to like kill the bacteria inside my mouth that causes the plaque and tartar and all that other type of stuff. Because I got good news, I don't have cavities, but I want to make sure that I'm doing my best to reverse whatever was going on, any issues that I had prior. And yes, I'm very happy that I made this purchase because minty fresh. So now I'm just like, when I shave my face, have a smooth face because my hair is growing back, but very soft. It's very soft. So when I shave my face be smooth, breath is fresh, then I'd be kissable. But I have nobody to kiss. But anyway, that's just my point. So that's just the struggles of my womanhood right now. And then on my ultrasound imagings, I saw, which they called it like a pelvic transvaginal ultrasound. They just took that probe and, first it was like my stomach was done, like my lower abdomen. And then they inserted the probe in my lady parts to get a closer look at my ovaries and my uterus. So my uterus was fine, my cervix was fine, which I'm happy about, because I had 2 surgeries on my cervix, so it's fine now, and the cancer is gone, so I'm very happy about that. So just like 3 issues I have right now, maybe 4. 4. I'll say 4 issues I have right now, health-wise, that if I keep seeking help to get rid of those issues, then I should be very happy. Okay, so like again, it's just for like my mouth, making sure that I get my smile back. Because before like this, all my gums were just swollen. Like I didn't know what was going on, why they were just swelling like that. But a lot of that swelling went down, and it's a lot better. It looks a lot better than it did like last year around this time. It looks a lot better. And A lot of the swelling has went down. You can still see that like I have swollen gums, but it's not like what it was before. So when I went to the dentist, like even what they were saying to me, I was like, if only they seen me last year. Uh, yeah. So I I do need the help. So I'm gonna continue with my dentist appointments. Um, and then this issue. So just making sure that I regulate my menstrual periods and communicate. I told my doctor that I will see her when I feel like I really need the medicines and the help to kind of get my menstrual periods back on track. But I told her I want to allow my body to